Kath McDaid, I'm the Project Development Coordinator for Yorkshire and the Humber, working for National Energy Action, which is the National Fuel Poverty Charity.
Did you come across making every contact count at the beginning of this?
I was working on a project that was funded by the Yorkshire and Humber Regional Public Health team, working with strategy managers in public health, trying to get affordable warmth and fuel poverty onto a PCT agenda.
Right.
Because living in a cold, damp home has so many health ill effects. I was working with all of the 14 PCTs as they were then, and some were fully engaged in this agenda and moving forward. Others needed some support and perhaps a bit of guidance, and perhaps a bit of somebody else coming in from outside and saying, "Oh, what about this agenda?" And I was looking for innovation.
Yes.
I was looking for something different, some way that I could connect with what was already happening, so that maybe they could link up with this agenda.
Yes.
And the normal public health agenda, very important issues such as obesity, alcohol, substance misuse, are very, very important. But the framework is where people live.
Absolutely.
And if they're living in cold, damp conditions, they're probably more likely to reach for a packet of biscuits, maybe reach for a can or whatever. And I was trying to make the links, and I came across it and thought, what a fantastic way of doing that. The field has got a long history of working on this agenda, and Doncaster, and the Director of Public Health in Doncaster has put his money where his mouth is, and he actually funded the first element of the project that the public health team at Region funded the second element of it.
Very good.
Rotherham, really taken the bit and very, very supportive, and developed the Keeping Warm in Later Life research project in partnership with Sheffield Hallam, and I've been involved in that.
Of course.
That was looking at how older people keep warm and how they spend their money and why they do spend it on heating or not. So everybody's having a little go at it, but some have got more support. In Wakefield, let's say, for example, they've got a very strong affordable warmth partnership which involves a lot of other organisations, including the fire service, the ambulance service, Department of Work and Pensions. They actually started a referral scheme called Hotspots, which Making Every Contact Count is linking into very nicely. And they've just developed a scheme called Snowbell in connection with Age UK and other charitable organisations, where if the weather gets really cold, the frontline professionals, the staff, they understand where these people are, and they're able to get out there and say, look, we're expecting some snow, and in 4 days' time, make sure you've got all your medication, and make sure you've got some food. Somebody knows where you are. Try and keep warm. And try and keep safe. The hotspot scheme actually runs across the whole region. The 5 West Yorkshire authorities have West Yorkshire hotspots, South Yorkshire hotspots for the 4 South Yorkshire. Over in North Lincolnshire and North East Lincolnshire, they've got it there. They've got it in Hull, and they've got a very similar scheme in East Riding called Health Through Warmth. So there is already a referral scheme. And a lot of my work in the past has been trying to engage with people to get this referral scheme into place, and also to have the partners in place to support those people who are referred, and it's working very well. We need more.
Of course.
I can't get round and train everybody.
No, of course not.
It's not possible. Making every contact count with the thousands of people who are being trained. It's a very short intervention. It's a brief intervention. It's about the patient, the client actually taking action on it. Hotspots requires the professional to take action. So I think there's a meeting of the ways, and actually being able to, I'm delighted that being able to get the story of affordable warmth and fuel poverty into people's heads through their training, through Making Every Contact Count, because it's surprising the number of people that have said, I've been into a cold, damp home, I put my fleece on before I go in, I deal with that person, that lady or that gentleman, and then I come away and I leave them cold. I haven't really considered that before, and the impact it's having upon the health. Now I have considered it, what can I do about it? And it's about linking everything together, because it's all there. There's lots of support mechanisms And after all, we're trying to prevent people from being ill.
Absolutely.
It's a big public health issue.
Yeah.
We're trying to prevent people going into hospital and having repeat admissions.
So it's a nice description, that, Kath, of utilising anybody, whether it be a fireman, whether it be a district nurse, whether it be somebody that's actually, their job is to look at warmth, but utilising that whole workforce to support each other in their own elements of trying to do this. And so that's, you're just opening up the workforce rather than closing them down. You're giving them an opportunity.
Absolutely. And with all the changes that we've had with, with the economic problems that we have, issues that we have at the moment, and people moving jobs or leaving their jobs, the jobs not being there, many of those people have already been trained, aren't there? So who's going to take their place? So let's think outside the box. Let's try and see who's there that can actually be informed about this and enabled to take action.
And you nicely described, if they're already there, then why not?
Exactly.
if they walk in and a place is cold, it's not something that you have to be genius about.
No.
You can feel it. And so therefore, if you know where to then pass on that information about Mary and Fred or whoever, then that's an easy thing for you to do. It doesn't take a lot of extra work involved, but it mobilises a massive workforce.
Absolutely. And it's about that person being in the home, being a trusted person as well.
Yes.
So if that trusted person is giving support or guidance or signposted, which is basically what it is, then that's more likely to be taken up than maybe say something that somebody reads in the paper or listens to on the radio.
Yeah, and we don't need to double up on people going into people's homes, do we? If somebody's already going in, whatever the reason, if they can look at a range of subject matters which are going to have an impact on that person's health, and then signpost, as you say, it makes a lot of sense, really.
It does. And it's surprising how many people that we've had through on training and awareness raising sessions that said, that's my mum, that's my dad that you're talking about, or that's my grandma, and really I wouldn't leave them cold.
No.
And so you get to that actual somebody thinking around the situation. They may not be able to do anything about the fact that somebody's got clutter everywhere or whatever, but if you see a trailing flex from an electric fire, from an older person staying in one room, and understand that that if they move out of a heated room into a cold house, they're more likely to fall. And all the other issues that go around isolation as well. Then I think you can get that feel good factor.
Absolutely.
That's saying it might only be a short action on my part, but it could make a massive impact upon that person's life.
And if you convert people in their work environment to be doing that, then they're going to take some of that back to friends and family, aren't they, as well?
I get people contact me that I've met professionally that have come back and said, can you give me some advice on so-and-so? And they do, and it becomes a bigger agenda.
And we need to mobilise the population, don't we? We've got, our job is to do it through our work, and that's great. But actually, we're trying to give people permission to say, actually, it doesn't only relate to your work, this. If you've got friends, colleagues, peers, anybody else in this place, you can utilise that knowledge and experience to be able to help them as well.
Yeah, definitely.
Good stuff.
I like to think that as well as the public health issues that are designed within white papers that actually say, we've got to stop obesity, we've got to get the nation fit and healthy, we've got to stop all the alcohol issues, antisocial behaviour and so on. I'd like them to think, and we've got to get people warm in their homes, because if they're doing that, then they might not be doing some of the other stuff. And I'd like to think that that's in people's heads, in those frontline professionals' heads, that they're the people, that they're the tools, they've got more power than they realise that they've got. I'd like them to think, how can we look at the framework of where people live? Because the environment does have a massive impact upon health.